Hello, it is December 2020, and consider this a personal guide to the management of COVID-19 in case it affects you or your family. I will go over questions of what to do at home, when to call your doctor, when to go to the hospital, and what may happen there. Things have changed significantly since March and April, so here we go. After exposure, the virus can take several distinct paths, from no infection at all to asymptomatic infection and then mild, moderate, and severe symptoms. We do know that risk factors such as advanced age, hypertension, diabetes, obesity, and others constitute higher risk of severe disease, but these are statistics and anyone can follow any path. An elderly diabetic may do just fine, and a young, healthy athlete can end up on a respirator in the ICU. This virus is fickle, and it is best to prevent it at all costs. Let us focus first on these two. If you know you are exposed, you have two options: to either isolate at home for 14 days or to get a test. Getting a test is easier now than it was in the spring, but it is still a hassle, and if you are feeling well and are committed to isolation, there is no strong reason to do it. Most people like to know, however, and if you do the test, do it at least 5 days post-exposure for the test to be accurate. There are two common tests: the antigen test by Abbott ID Now technology, which is okay but no guarantees, and what we call the PCR test, which is considered to be very accurate. Latest CDC guidelines tell us that when you are feeling well, you can possibly leave quarantine after 7 days with no symptoms and a negative test, so you can gain a week by sticking a Q-tip in your nose. Your choice. Note that CDC, under some pressure I would say, allows local health departments to lower the quarantine period to 10 days, but I would personally stick to 14, especially when hugging grandma is involved. So, if the test comes back negative, you are good, and if you want to be sure, you can still take an antibody test a month later. This is a blood test and will tell you with great certainty if you've had the disease in the past and can serve as a double check for you. If the COVID test comes back positive, however, the waiting lottery begins. The lucky ones sail through it without any symptoms at all. Let us focus on this side of the graph now instead. On average, the first symptoms of the coronavirus infection occur on days 5 through 6, with day 14 still serving as a good cutoff. The most common symptoms remain fever, dry cough, and fatigue. These are the classics, though as you can see, other symptoms such as nausea, vomiting, diarrhea, as well as the famous loss of smell can occur as well. A mild case of COVID involves 2 to 3 days of some of these symptoms, followed by a quick recovery. Generally, there is no specific treatment for this degree of severity, and though you are welcome to call your doctor, they will likely steer you to a video visit at most. People take a variety of medications at this stage, none of it proven to work, but considered relatively safe. This includes vitamins D and C, zinc, antacid medicine famotidine, and a sleep aid melatonin. No data on any of this, but plenty of internet speculation, so the choice is yours. In general, these patients get better no matter what you do. Things change for the moderate cases, and there are some new options here. When it comes to being COVID positive and having your first fever, it pays to know which symptoms are expected to come and go and which predict a more serious case. Looking at this again, there are two symptoms that make me particularly concerned about my patients, and these are significant body and muscle aches and shortness of breath. When these occur alongside the fever in the first few days, I worry, as these patients are much more likely to need hospitalization. The shortness of breath plus fever combo especially warrants a call to your doctor no matter how old or young you are. In the spring, we sometimes use the famous hydroxychloroquine for those cases, but we no longer use this medication. Instead, my patients get two options, both new and both coming with caveats. Option number one is enrollment in an interesting study called Call Corona. This is a multinational study that is available in these locations, including in the tri-state around New York City, where it is managed by NYU Medical Center. This study uses an old gout medication colchicine to see if its anti-inflammatory effects protect the body against severe COVID response that happens due to overreaction of the immune system towards the virus. That overreaction is what puts people on ventilators, and the question is whether colchicine can prevent that. This is still investigational but has some good preliminary data behind it, and since colchicine is well known and generally safe, I recommend enrolling in the study if possible. The website is here. Most of it is done remotely. You get colchicine or placebo FedEx to your house, and the medication is free. You do need to meet certain criteria to qualify, but if you do, go for it. It is crucial to enroll within 48 hours of the positive test, but if you are an at-risk individual with fever, shortness of breath, and/or body aches, I would not wait. Talk to your doctor first, but know that starting early is critical here, and any of my patients can contact me to get enrolled. Whereas colchicine is part of an ongoing study, option 2 has now been approved with emergency authorization from the FDA. I am talking about the coronavirus antibody treatment, or the Trump cocktail as people call it, as this was the medicine that made Trump better. This drug is basically a cocktail of anti-coronavirus antibodies, which is meant to help your immune system fight off the virus before it starts taking hold in your lungs. There are 2 cocktails currently available, one from the company Regeneron, which Trump got, and the other from Eli Lilly, which is essentially the same. Eli Lilly was first to get the emergency FDA approval, and that was based on this study called BLAZE-1. The study showed that the neutralizing antibodies reduce viral load, symptoms, and COVID-related hospitalizations and ER visits, so that's great. Here are some details. As you can see, the drug makes you feel better sooner. The blue line is the drug, the red is the placebo. It also reduces hospitalizations from 6% for placebo to about 2% for the drug. But there are caveats. It has to be given after you start feeling unwell enough to want it, but before you need to go to the hospital. Once you are sick enough to hospitalize, the FDA authorization expires and you will not get the drug in the hospital. Also, this is far from the silver bullet, as it only helps 1 in 22 of average patients and 1 in 14 of higher risk patients. Still, the drug is a new option as of this week, and when used smartly, it could be of help. So here are the inclusion criteria for it, and a reason to call your doctor right away if you fall into this group. And now to the severe, knowing that we still have critical to cover. Let us look at the progression of the disease so far. In mild cases, you get sick on average day 5-6 from exposure, then get quickly better. In moderate cases, you get sick at the same time, but the symptoms linger, sometimes for up to 3 weeks. We will not be covering long-haul COVID here that lasts for months, but that is possible too. Severe cases are different because they follow a different trajectory. For those, you still get sick around the same time from exposure, you then get better, but then you get worse again, and by day 8 start to have shortness of breath. If this stays untreated, day 10 is when you get to the hospital and get intubated in the ICU on days 12 through 14. So, the question is, what do you do on day 8 to prevent intubation several days later? By now, everyone should have a pulse oximeter at home. They are cheap and very helpful in deciding on when to go to the hospital. Whereas some fever, cough, and body aches still keeps you at home, shortness of breath should prompt thinking you about the next step. Learn how to use pulse oximeter properly, and you can use those results to guide your decision here. Severe COVID is defined as resting room air oxygen saturation of below 93%. So, if you are short of breath and at 92% or less, it is time to go to the ER. There are 3 treatments for COVID that await in the hospital, and sooner you start them, the better. These are remdesivir, convalescent plasma, and dexamethasone. Among these 3, dexamethasone is most effective at staving off severe disease, but the other 2 have a role to play too. Again, I have to warn you that these are not curative and do not help everyone. Every patient in our ICU had been given these drugs, and all of them still progressed. But, of course, they do work by reducing your chances of going there. Once in the ICU and intubated, you progress to critical stage, where the chance of dying is significant, though not written in the cards. One way or another, you want to do as much as you can to prevent getting there. So, to reiterate, watch for fever, cough, fatigue as the first signs of COVID. Call your doctor as soon as you can, but also watch for muscle aches and shortness of breath to know that more severe disease could be coming. Colchicine is an option there, and so is the antibiotic cocktail from Regeneron or Eli Lilly. Once shortness of breath and oxygen saturation below 93% occur, go straight to the hospital for further treatments and do not wait a minute longer. I hope this is helpful, and please stay safe out there. Remember, prevention is key.